Section 1. A cascade of chaos, understanding DIC. Imagine a system designed to protect you suddenly turning against you. That's disseminated intravascular coagulation, or DIC, a condition where the body's intricate clotting mechanism goes haywire. Instead of controlled clotting to staunch bleeding, DIC triggers a chaotic cascade of clotting throughout the bloodstream. This leads to a paradoxical situation: excessive clotting and excessive bleeding simultaneously. DIC is not a disease in itself, it's a syndrome, a constellation of symptoms that arises from another underlying medical condition. Think of it as a domino effect, where the initial domino could be anything from a severe infection to trauma or even cancer. This underlying condition sets off a chain reaction, ultimately leading to the dysregulation of the coagulation cascade. This uncontrolled clotting within blood vessels creates a traffic jam of sorts, obstructing the smooth flow of blood and oxygen to vital organs. Simultaneously, as clotting factors are consumed in this chaotic process, the body's ability to control bleeding is compromised, leading to uncontrolled hemorrhage. Understanding DIC is crucial because it's a life-threatening condition, demanding immediate medical attention. Recognizing its signs and understanding its underlying causes can make all the difference in timely diagnosis and treatment. Section 2. When the body turns against itself, causes and triggers of DIC. DIC is like a fire alarm going off in the body. It signals that something is seriously wrong. But what exactly triggers this alarm? The answer lies in a wide range of underlying conditions, each capable of setting off the DIC cascade. Infections, particularly severe sepsis, are among the most common culprits. Picture bacteria invading the bloodstream, releasing toxins that activate the clotting system. Trauma, especially severe injuries involving significant tissue damage, can also trigger DIC. Imagine a car accident victim with multiple fractures and internal bleeding. The body's response to such trauma can inadvertently initiate DIC. Certain types of cancer, especially leukemia and some solid tumors, are also known to increase the risk of DIC. These cancers can release substances into the bloodstream that interfere with normal clotting. Even pregnancy complications, such as placental abruption or amniotic fluid embolism, can disrupt the delicate balance of the coagulation system, making pregnant women susceptible to DIC. Understanding these potential triggers is crucial for both prevention and early detection of DIC. For instance, prompt treatment of infections can prevent them from escalating to severe sepsis, thereby reducing the risk of DIC. Similarly, careful management of pregnancy complications can minimize the likelihood of DIC development. Section 3. The language of DIC. Decoding the symptoms. DIC is a master of disguise, often mimicking other conditions and making its early detection a challenge. However, understanding the language of its symptoms can help us decipher its presence and seek timely medical intervention. One of the most telling signs of DIC is unexplained bleeding. This bleeding can manifest in various ways, from easy bruising and prolonged bleeding from minor cuts to more serious internal bleeding and organ damage. Imagine a patient suddenly developing unexplained bruising all over their body or experiencing persistent bleeding from a simple needle prick. These could be red flags pointing towards DIC. Another hallmark of DIC is the formation of blood clots, which can obstruct blood flow to vital organs. This can lead to a range of symptoms depending on the location of the clot. For instance, a clot in the lungs can cause shortness of breath and chest pain, while a clot in the brain can result in stroke-like symptoms such as sudden weakness or difficulty speaking. Other symptoms of DIC can include low blood pressure, organ dysfunction, and a drop in platelet count, which are essential for blood clotting. Recognizing these diverse manifestations of DIC is crucial, as early detection can significantly improve the chances of successful treatment. Section 4. Inside the lab. Unmasking DIC through blood tests. Diagnosing DIC is like piecing together a complex puzzle, and laboratory tests serve as the crucial pieces that help us see the complete picture. These tests provide a window into the chaotic state of the coagulation cascade, confirming the presence of DIC and guiding treatment strategies. One of the key tests is the prothrombin time, or PT, which measures the time it takes for blood to clot. In DIC, the PT is often prolonged, indicating that the clotting process is taking longer than usual. This delay reflects the depletion of clotting factors consumed in the uncontrolled clotting process. Another important test is the activated partial thromboplastin time, or APTT, which also measures the time it takes for blood to clot, but through a different pathway. Similar to PT, APTT is also typically prolonged in DIC, further confirming the disruption in the coagulation cascade. The D-dimer test measures the breakdown products of fibrin, a protein involved in clot formation. Elevated D-dimer levels indicate increased clot formation and breakdown, a hallmark of DIC. Imagine a construction site with piles of debris. Similarly, elevated D-dimer levels reflect the debris left behind from the continuous formation and breakdown of clots in DIC. By analyzing the results of these tests, along with the patient's clinical presentation, doctors can confirm the diagnosis of DIC and tailor treatment plans accordingly.